In the heart of Benin City, a silent crisis unfolds every day. Accidents, illnesses, and emergencies strike without warning, leaving individuals and families vulnerable.
Emergencies, you can't really plan for them.
In 2024, the Edo State government, in partnership with Emergency Response Africa, initiated the Edo Emergency Medical Services, Edo EMS.
When I dial the number 112, immediately.
Edo EMS, please, there's a ticket sent to your CR.
Okay, I'm on it.
Oh, I think there's been an emergency road traffic accident in Ring Road. Get it.
The program launched life-saving emergency services across Benin City, with a focus on establishing a cost-effective way of managing medical emergencies through the training and equipping of community-based first responders, going live on April 1, 2024. We tell the stories of those at the heart of Edo EMS, from patients and hospital partners to the leaders who brought this vision to life.
For us in Edo EMS, the first thing we think of is the life saved.
Every year, more than 1 million Nigerians die from various emergencies. Unfortunately, we don't have a robust and active emergency response system. And yet, research shows that access to emergency care can actually reduce preventable deaths by more than 54%. And so it became really important to build a collaboration that would allow the citizens of Edo State access to emergency medical response.
The emergency medical service is part of what we have put in place as a government to ensure that lives of people are taken care of, spared, and then they get timely intervention when emergencies occur. The overall goal for us in healthcare, whether you are in the ministry or in the hospital, is to ensure that lives are saved.
For many, quick access to emergency services can be the difference between life and death. Let's hear directly from those whose lives were impacted by Edo EMS.
A couple of months ago, I think around August, my mom had hypertension. It was really scary. I've never seen such in my life. She was a bit okay. She ate, and then all of a sudden, she collapsed. I was so devastated. I didn't actually know what to do. My head was blank. At this time, it was about 10:35 p.m. I think within 11 to 12 minutes, they were here in my house. I could hear their siren blasting. Their presence that they made a huge difference, and I'm forever grateful.
One of my members actually brought the daughter to my house.
So this baby was sick when it was almost 1 year. My baby body dey hot. Before you know, they get seizure. In hand and leg they shake. He ceased breathing, he no dey breathe. I run go my pastor house. I reach my pastor house. My pastor call me call Edo EMS.
When I dial the number 112, immediately the staff just picked.
When he called them, they said that they come. Where be the place? They come, they run, they come. At the end, we block them from Musheshe Junction. That is Edo EMS. We block them from Musheshe Junction. They carry me with ambulance. They fix oxygen for my baby for inside the ambulance. They take us to Ikpoba-Okha. As we reach Ikpoba-Okha, they stay with me some time before they fix drip for the baby, fix oxygen for the baby before they come leave me that night. So I really appreciate them. If not be there that night, I don't know what for happen. Because no motor, it was around 1:30. No motor, nothing. So that day as I called them, and so my body they shake, say, hey, I go fit pay today. I don't know how much they want pay. I dey ask pastor how much they want pay. Pastor say make the first come first. He never know how much they pay. But at the end, to greatest surprise, I went to Ikpoba-Okha. They carry my baby, give them for Ogbowo, they admit them. 1 naira, they not collect, they not ask me any money. Since that day till now, they not ask me any money. I don't even get number to even call them. So now make they tag them. So una do well. God bless you now. May God give una power. Mona they do more in Jesus' name.
Behind every call, there is a trained first responder. Everyday heroes who work to save lives and make health services more accessible in their communities.
People actually want to help other people in an emergency. We have individuals who are willing to help those in their community, but oftentimes they don't know what to do and they don't feel confident in taking action because they lack the skills.
I found the CBFR as a position and a way for me to give back to the community and help improve my community.
The training actually made me see the possibilities of being able to help those in need that have medical emergencies.
We had more than 3 times the number of people that we needed nominate themselves or volunteer as community-based first responders.
The success of Edo EMS relies on strong partnerships with hospitals. Together, they ensure that patients get the urgent care they need when they need it most.
Since the inception of the Edo EMS, the University of Benin Teaching Hospital has played a very pivotal role in various aspects, from the development of the curriculum, provision of resource persons to train the community-based first responders. The institution has also collaborated with the Edo EMS in the reception of patients that are referred to the hospital. Since the launch of the Edo EMS, we have noticed that citizens who hitherto would not have been able to access healthcare are able to access the healthcare at our facility.
Edo EMS has been a very helpful partner in terms of emergency service delivery for us. It falls in line with our strategic plan. One of the biggest challenges we have noticed and we've seen in our practice is that quite a number of persons here come quite late without them even having any kind of first aid. So the EMS for us, beyond everything, you created a kind of awareness around emergency medicine care delivery in this part of the world. And people have begun to see that they are part of it. They must be part of it. Because people now know that you do not need, the first thing is not just to rush the person to the hospital. There are little things you can do. And practically most of the patients that are brought to us, by the time they are being brought to us, they are not usually that critically ill, except very few.
Edo EMS has really impacted on us because we've had opportunity to minister or to treat emergency cases, which hitherto would have not come to our notice. And not only that, the volume of emergencies has also increased. We even need more team, more ambulances, more stations.
At the heart of Edo EMS is a dedicated team working tirelessly to ensure the project's success. The success of Edo EMS is built on collaboration between key stakeholders. Their vision and support have been crucial to bringing emergency medical services closer to those in need.
We have a partnership with the Federal Ministry of Health, the National Primary Healthcare Development Agency, the Edo State Primary Healthcare Development Agency. There's also the Emergency Medical Service Gateway to ensure that even coming from what the Federal Ministry of Health has put in place as a state, we've also wholeheartedly embraced this policy. There's a popular mall in Benin City I went to, and somebody collapsed. I saw that one of our vehicles for emergency medical service came to that place, and so I followed closely to see what was going to happen. And I was very impressed with not just the speed with which they got to that point, because of course I had to ask questions, but when they got there, they were very professional about the way they went about it. I can say to a large extent, let me not blow our trumpet, but I'm sure that as high as 95 to 98% of persons who have had reason to use this service will tell you that irrespective of where calls came from. Their needs have been met. The command and control center too.
I want to see an EMS that is technologically driven. I want to see an EMS that will also expand to Edo Central.
So future plans for Edo EMS beyond this pilot phase include expanding it to other parts of the state. As of today, Edo EMS is operational in 3 local governments within Benin City, but there are 15 other local government areas across the state that need access to this service. So we're very excited that the Edo State government has already committed to expanding into another senatorial district over the course of this year, and that's something that we'll be looking forward to.
Through collective efforts of government care providers and dedicated community members, Edo EMS has made significant strides in emergency medical services. Expanding its reach, Edo EMS now covers 3 local government areas: Oredo, Egor, and Ikpoba-Okha local government. With a fleet of 4 fully equipped ambulances, response times have improved dramatically. The program has successfully trained 175 community-based first responders, empowering locals to act swiftly in emergencies. Strong partnerships have been forged with 4 hospitals, ensuring seamless patient care. Collaborations with 8 primary healthcare centers have further strengthened the network of support. Edo EMS continues its mission to save lives, one community at a time. But this is only the beginning of what is possible for emergency healthcare in Edo State.